There's a bit of a sigh of relief for people who are using ARVs, especially about 45 million shillings worth of taxes has been waived. Let's get the exact figure. As the National Treasury has waived taxes amounting to 45.8 million shillings to facilitate the clearance of the ARV drugs being held at the port of Mombasa. Treasury has also consigned the drugs to the American Embassy as a stopgap measure in order to save the situation pending the conclusion of the formal engagement framework between the government and the USAID. Dorcas Wangira has more.
Appearing before the Senate Standing Committee on Health Monday, Cabinet Secretary, National Treasury and Planning, Ukur Yatani was put to task to respond to the standoff over HIV/AIDS commodities with the United States Agency for International Development, USAID. To address the stalemate which has persisted since January, the CS submitted that the government had put in intervention measures, including foregoing 45.8 million shillings duty.
Waziri, don't you find it ironical that it is the USAID that has problems with KEMSA and the government per se, yet Global Fund doesn't have the same problem?
The expenditure is not known, and we keep on giving exemptions. There's likely to be a loophole along the way. I think that's why the Minister of Health were very keen in making sure that some level of openness is exercised. Where the drugs go, who are the beneficiary, how was it distributed, and the reporting part of it is also clearly within the knowledge.
The Treasury's consultations with USAID, Yatani posited, established that the drugs were imported to Kenya without a formal engagement framework. According to USAID, the delay in formalization of the framework was partly occasioned by the elections in the United States. The previous agreement between the Kenya Medical Supplies Agency, KEMSA, and USAID Medical Commodities Program, MCP, which was signed in September 2015, amounting to $649,997,960 US for a period of 5 years, had lapsed on 30th September 2020.
The USAID are telling us, there was a delay as a result of election in their country. But along the same, it appeared, they were also not very comfortable with using KEMSA or the Minister of Health as a direct beneficiary for distribution. Having undertaken this, realizing that, and these commodities were stored at the U.S. Embassy over the period when there were challenges in sorting out the issue of taxes.
Further, USAID had contracted a private-based company, Chemonix, to distribute the drugs, citing corruption with KEMSA as a major stumbling block. But this, according to Ukur, will be resolved once USAID concludes a public finance management risk assessment it is conducting at various government departments. The HIV response in Kenya is largely dependent on external resources. HIV health commodities are mainly funded by 3 agencies: the Government of Kenya, the Global Fund, and USAID. The funding from the Global Fund and USAID are grants, and together they fund more than 80% of HIV commodities. The total USAID contribution is estimated at $500 million per year, both on and off budget combined. The government of Kenya, through the National Treasury, also provides co-financing funds for the fight against HIV, TB, and malaria. This is a requirement to access the Global Fund allocation. In the 2018 to 2021 allocation period, the Global Fund grant amounted to approximately $310 million. To reduce donor dependency, Treasury points out increased Kenyan ownership as critical through the universal health coverage. Dorcas Wangira, Citizen TV, Nairobi.